Hi, this is Robert Polenic, the owner of Brutal Iron Works. In this video we're going to discuss a treatment for the lower quadriceps right above the kneecap. This area can be very tight and sensitive for people during squats and jumping, so this treatment is intended to loosen up that tissue and alleviate some of that discomfort. So again, we would be asking if they've had a previous injury so that we know if there's any contraindications or anything we need to work around in this treatment. So the position you can see is they'll be seated and they're going to have a position where they can have their feet hanging and free flowing, they can move, and they'll actually be able to do this treatment for themselves once you've showed it to them. So what we'll do is we'll start with our standard short roller, and this allows us to work on one leg at a time. They're going to start it in their mid-thigh. They're going to roll it back and forth a little bit just to get used to the pressure of the roller and to work out any tightness that might be in that area. So then they're going to go ahead and roll it down to the top of their knee, so the lower area of the quadricep, and they're going to try to stay off the kneecap. You want to stay off any bone areas. And we're going to try to get into that connective tissue of the patella tendon, and that way we can work that area loose. We're going to go ahead, once we're in that area, we're going to go ahead and press down a little bit to create some pressure. We can actually wiggle the roller a little bit back and forth, and they can actually throttle the roller forward and backward. What this does is it grinds down into that tissue and it helps separate the layers from each other, creating an easier range of motion. So once they have that, they've done through that little protocol, they can then go ahead and keep the roller in that area and actually practice mini leg extensions. They can go up and down a little bit. They can also, while they're doing that, apply those different modes of treatment. They can press down, they can wiggle, they can throttle a little bit while they're kicking their leg. And again, this is all to loosen up that tissue right above the knee. So they can do this to however they feel they need. So maybe 30 seconds to a minute, they just go through the treatment as they feel comfortable doing so. Okay, thank you.